Welcome to an overview of prescribing principles in special populations, focusing on pregnancy and renal and hepatic considerations. We will explore psychotropic medications, their mechanisms, and critical prescribing decisions for vulnerable patient populations. Prescribing for special populations, particularly pregnant and lactating women, and patients with renal or hepatic impairment, requires nuanced clinical judgment, evidence-based risk assessment, and a commitment to patient-centered care. These groups are often underrepresented in clinical trials, making extrapolation of safety and efficacy data complex.
Identify classes of psychotropic medications, their therapeutic indications, pharmacokinetics, and pharmacodynamics. Antidepressants include SSRIs, SNRIs, and tricyclics, each with distinct half-lives ranging from hours to days, targeting serotonin and norepinephrine reuptake. Antipsychotics block dopamine receptors, while mood stabilizers like lithium have complex mechanisms affecting multiple neurotransmitter systems.
For pregnant and lactating women, key considerations include
Placental transfer. Lipophilic, low molecular weight drugs can cross the placenta, potentially affecting fetal development. Teratogenic risk. Avoid medications known to cause congenital anomalies, especially during the first trimester. FDA pregnancy categories. While phased out, they have been replaced by narrative risk summaries under the Pregnancy and Lactation Labeling Rule, or the PLLR. Physiological changes. Increased plasma volume, altered renal clearance, and hepatic enzyme activity can affect drug pharmacokinetics. Breast milk transfer. Consider drug lipophilicity, protein binding, and half-life. Use resources like LactMed to assess safety during breastfeeding. First trimester exposure carries highest teratogenic risk, while third trimester concerns include neonatal adaptation syndrome.
To prescribe to pregnant or lactating women, use the lowest effective dose for the shortest duration.
Prefer drugs with long-term safety data in pregnancy. Avoid polypharmacy unless absolutely necessary. Engage in shared decision-making, especially when balancing maternal health and fetal risk.
Select appropriate psychotropic medications for special populations, patients and those with renal impairments. Key considerations include reduced clearance. Drugs eliminated via the kidneys may accumulate, increasing toxicity risk. Altered pharmacodynamics. Uremia can affect drug receptor interactions. Dialysis. Impact. Some drugs are removed during dialysis. Dosing schedules may need adjustment. When prescribing to patients with renal impairment, estimate renal function using eGFR or creatinine clearance. Adjust dose or dosing interval based on renal function staging. Monitor therapeutic drug levels and clinical response. Avoid nephrotoxic agents when possible. Creatinine clearance guide dosing decisions, with some medications contraindicated in severe impairment. Lithium requires dose reduction in renal impairment. Key considerations in patients with hepatic impairments. Impaired metabolism. Drugs metabolized by the liver may have prolonged half-lives. Reduced albumin alters protein binding, increasing free drug concentration. Portal hypertension and ascites may affect drug absorption and distribution. To prescribe to patients with hepatic impairment, use Child-Pugh score to assess severity and guide dosing. Prefer drugs with renal elimination when hepatic metabolism is compromised. Avoid hepatotoxic medications or monitor liver enzymes closely. Consider non-pharmacologic alternatives when feasible.
Explain legal, efficacy, cost and safety factors when making prescribing decisions for psychiatric and behavioral health patients.
Evidence-based prescribing requires reviewing clinical trial data, considering individual patient factors, and monitoring treatment response. Cost considerations include generic availability, insurance formularies, and long-term healthcare utilization impacts of effective treatment.
Successful psychotropic prescribing requires comprehensive knowledge of medication classes, special population considerations, and multifactorial decision-making. Always prioritize patient safety, consider individual risk factors, and maintain ongoing monitoring for optimal therapeutic outcomes.